Good morning. All right. Welcome to the 2019 Symposium on Child Sexual Abuse from a Public Health Perspective. Welcome to those of you in the audience and to those of you who are joining us via our live stream. We are delighted to welcome many of you back and to see so many new faces. My name is Elizabeth Letourneau, and I am the director of the Moore Center for the Prevention of Child Sexual Abuse and a professor in the Department of Mental Health here at the Johns Hopkins Bloomberg School of Public Health. The vision of the Moore Center is a world free from child sexual abuse. Our mission is to enable this vision through research, education, communication, advocacy, and policy. This year's speakers highlight each of these specific areas of our work. You will hear about our research with presentations from Dr. Rajmi Nair, Dr. Kenneth Fader, and Dr. Ryan Shields. Our educational efforts include mentoring doctoral, master's, and undergraduate students to be the next generation of public health scientists with a strong focus on abuse prevention. I'm grateful to have these students in my life and for their support of today's symposium. Those of you who registered for our Lunch and Learn will hear one of our doctoral students, Mr. John Thorne, present on some of our work. Also following under education, we continue to offer continuing education credits at this symposium with the support of Ms. Shante Hatcher, who those of you who signed up for the credits would have seen on your way in. So we thank her and her support. Our communications efforts aim to provide objective and accurate information about the prevention of child sexual abuse to the media, to policymakers, to our multidisciplinary stakeholders and colleagues in law enforcement, child welfare, education, and the general public. At today's symposium, we will hear from two law enforcement experts, Detective Bob Schilling and Detective Sergeant John Linton. Our advocacy and policy efforts support improvements in how we prevent and address child sexual abuse at the local, state, national, and international levels. This year, the Moore Center supported Maryland State Delegate C.T. Wilson and the Maryland State Council on Child Abuse and Neglect in successfully passing state legislation that eliminates the ability of school personnel who have been disciplined for sexual misconduct in one school from simply moving to another school. At the federal level, we continue to pursue funding to support child sexual abuse prevention research. Just to give you a sense of where the U.S. puts its resources, we spend $512 million every single year to incarcerate sex offenders in federal facilities. $512 million to incarcerate sex offenders in federal prisons every single year. We believe that the federal government should also invest in prevention efforts and spend $10 million each year for the prevention of child sexual abuse, which amounts to less than 2% of what we spend just to incarcerate offenders. With our partners at CRD Associates, we successfully obtained language in last year's appropriation bill report to identify gaps in child sexual abuse prevention and what resources are needed to fill those gaps. That was step one. Step two is to work with Congress to appropriate $10 million in new funding for the Centers for Disease Control and Prevention that will support child sexual abuse prevention research. I'm very pleased to say we have broad, bipartisan, bicameral support for this funding request, including support from Maryland Senators Mr. Ben Cardin and Mr. Chris Van Hollen, and from Maryland Congressman Dr. Andy Harris, who's an alum from our school. We have an amazing program lined up for today. I'm enormously grateful to our speakers. In addition to the speakers I've already mentioned, we will hear from representatives of two foundations working to prevent child sexual abuse and exploitation, including Thorn, which is based here in the United States, and the Lucy Faithfull Foundation, which is based in the United Kingdom. In addition to our speakers, I would like to recognize some of the organizations that have partnered with us and that are present here in the audience. These include the Bloomberg American Health Initiative and Bloomberg Philanthropies, the Hand Foundation, which is supporting today's symposium, Reliance, Oak Foundation, World Childhood Foundation, Darkness to Light, the Daniel Family Foundation, the International Center for Missing and Exploited Children, the Governor's Office of Crime Control and Prevention in Maryland, the State Council on Child Abuse and Neglect, the Family Tree, the Baltimore Child Abuse Center, and other child advocacy centers. We also welcome for the first time Mrs. Ronit Raphael, the founder and president of El Raphael Beauty and Spa Products, and the founder of Tom's Secret, a child sexual abuse prevention foundation. Welcome, Ronit. And of course, we are joined by, and profoundly grateful to, our founding benefactors, Dr. Stephen Moore and Mrs. Julia Moore. Thank you. Thank you all for joining us today. Yes. Thank you. Now, before I introduce our keynote speaker, I want to draw your attention to your folders. And I'm going to ask a question actually I should have asked when I started talking. Can everybody hear me okay? No, good, excellent, I'm glad to hear that. Each of you received a copy of our annual report. In that report, you'll find our center's mission and vision, some highlights about our work, pictures from last year's symposium, and a description of our marvelous faculty and staff. In the pocket at the back of the folder, you're going to see an index card, a brochure about today's event, and a one-page description of the Moore Center. We also have, well, the index card is for you to write questions down for our afternoon panelists, and I'll explain that in a little more detail when we come back in the afternoon, after lunch. There is also a shameless plug for a one-day class that the Moore Center faculty teach. It's June 12th. Register today. And there's a survey. We take these surveys very, very seriously. Please complete the survey at the end of the day or whenever it is that you have to leave. And I will, again, come back to the survey at the end of the day. Now it's my real pleasure to introduce our keynote speaker, Dr. Joshua Sharfstein. Dr. Sharfstein is Vice Dean for Public Health Practice and Community Engagement. He is Director of the Bloomberg American Health Initiative and Professor of the Practice in our Department of Health Policy and Management here at Johns Hopkins Bloomberg School of Public Health. Prior to taking, and I think actually creating the role as Vice Dean, Dr. Sharfstein previously served in several federal and state public health capacities. From 2001 to 2002, he served as health policy advisor for Congressman Henry A. Waxman. From 2005 to 2009, Dr. Sharfstein served as Commissioner of Health for Baltimore City. In 2009, he was appointed by President Obama to serve as the Principal Deputy Commissioner for the U.S. Food and Drug Administration. In 2011, he was tapped, not attacked. I don't know what Governor O'Malley did to get you to work with him. Maybe he attacked you. He was appointed, let's say, by Governor O'Malley to serve as the Secretary of Maryland Department of Health and Mental Hygiene. And then Johns Hopkins Bloomberg School of Public Health poached him, and I'm very glad that we did. Dr. Sharfstein has been a strong ally of the Moore Center and our efforts to prevent and address child sexual abuse, particularly abuse that occurs within the context of institutional settings. As just one example, in 2016, he served as a key member of the Prince George's County Public Schools Student Safety Task Force. This task force was convened following allegations that a teacher's aide had filmed child sexual abuse acts at one of the Prince George's County's public elementary schools. Dr. Sharfstein's membership on that task force ensured that their final recommendations were based in sound theory, sound science, sound practice. Those recommendations were adopted and implemented by the entire PG County Public School District, which is among the largest 25 public school districts in the United States. It is my very real pleasure to welcome Dr. Sharfstein to serve as our keynote speaker. Oh, you know what? I'm behind one.
Wow. I like the more general one. There we go. We're going to go with that. I can't talk in front of my picture like that. So thank you so much for having me here at this really important event. I want to thank the Moores for their incredible vision to create a center focused on a problem that people often don't even like to talk about, and Elizabeth Letourneau for her work making that vision a reality. I'm sure when you had the idea to have this kind of center at Johns Hopkins, you could only imagine that these kinds of events would be happening and all the work would be happening here at the school. And I know how hard Elizabeth and her whole team work to make that possible. I'm here also on behalf of Dr. Ellen McKenzie, who's the dean of the school. She is a huge supporter of the work of the Moore Center as well. So I will start my remarks where Elizabeth left off. A few years ago, I received a call from the CEO of the Prince George's County Public School System because a horrific episode of child sexual abuse had been uncovered. And he asked me to participate in a group that included a prosecutor, a parent, a school official, to make recommendations so that what happened to the children in this case would never happen again. The effort started where most discussions of childhood sexual abuse start. We probably met 5 or 6 times for several hours down in the school system with sort of recounting a catastrophic and really unfathomable series of events. The perpetrator would face much deserved criminal charges. A lot of people were focused on, why was it the teachers let the students out, for something? Why didn't they ask? A lot about the actual events. But as we learn more about this topic, we realize that failures had occurred at multiple levels. The first failure was a failure of understanding. Most abuse occurs from people that kids know. Children trust adults they know, and many don't have the vocabulary or understanding to realize what is unacceptable, particularly based on their age and cognitive development. Yet most education at the time was targeted to children, instructing them to avoid strangers. So right there, we realized something was fundamentally off. They're being taught, don't go with strangers, don't go with strangers, trust people you know, and then it's the people you know who are causing the problem, as happened in this case in Prince George's County. We also learned that prevention requires more than session aimed at kids. I think a very common misunderstanding was that you educate the kids have to be the ones who are going to figure out that there's a problem and tell people. That is not generally what's going to happen. It is adults who have to protect the kids. That was a fundamental misunderstanding that I had and other members of the group had too. Prevention requires everyone to feel a sense of responsibility for kids when you're around kids. The second issue was what we would call it a failure of responsibility, not just of understanding. That there were background checks, it turned out they weren't consistently implemented, and those were the job of one office. Then the education was the job of another office, and neither of those offices were the school leadership that really understood the situation the best and was in a best position to protect kids. In fact, the school leaders, the principals, others, this wasn't even remotely on their radar screen. They thought it was handled by the background check people and the education people. They didn't really see this as their job at all. A third failure was a failure of oversight. There was no office that was charged with developing and implementing preventive strategies. Yet so much was at stake for the trust of parents in the system, let alone the health of kids. And so you had something that turned into just, a catastrophic event, not only for kids, but for the school system. And there had been nobody really responsible for making sure that things were done right. You might think it was impressive for a small committee to focus so much on prevention. I will say that we had a little bit of help from the Moore Center in doing that. Elizabeth made herself available for multiple meetings with the group, shared information, reviewed the curricula that were being used in Prince George's County, provided us with all kinds of input, and did it in a way that, I'll just say, it would not be unreasonable for her to come in there and just sort of kind of teach down to everybody, but she did it in a way that really inspired people to want to make the right kinds of recommendations and feel like we were learning alongside her, although I knew that she knew it already. She spent hours not only sending us materials and teaching us, but also helping the group reconceptualize childhood sexual abuse from a criminal justice issue alone, from a matter of just perpetrators, to a public health challenge. And we walked out of that session thinking that childhood sexual abuse can be prevented. And I'll just say that again, because it is so rarely part of the discussion about childhood sexual abuse that it can be prevented. But to protect children, we need to invest in developing the science and practice of prevention. Even an investment of 1 or 2% of what we spend to arrest, try, and incarcerate sexual offenders could yield major benefits for children. So what are the core elements of a public health approach to child sexual abuse prevention? And I understand that's what you'll be talking about today, in part. When I think of what is a public health approach, sometimes when I'm, trying to procrastinate, I will Google, quote, public health approach and see what people are saying needs a public health approach or what people are calling a public health approach. And it is a little bit of a whiteboard for people to throw up ideas on. Pretty much anything could be called a public health approach. Sometimes I'm in meetings where I go, where you just said that? About just arresting everyone. That's not actually a public health approach. You can call it a public health approach, but that's not actually a public health approach. And if I'm really feeling aggravated, I might say something like, I happen to work at a school of public health. So that's sort of where my perspective comes. When people say that, what do they mean? And I'll take them back, I think, fundamentally to the Institute of Medicine, 1988, where they said that it really is 3 things: assessment, program development, and assurance. A public health approach to something is very empirical. You want to start with facts. You don't want to let your biases and other things come in. You try to understand a problem. Then you try to address it based on your best understanding of it, and you check to see whether it worked. It's very, very empirical. A public health approach to a problem is very empirical. If we had that, we would not, if you came in with biases from the beginning, we never would have developed syringe exchange programs, which are a part of a public health approach to addressing addiction. And it turns out they're incredibly effective at reducing infectious disease and in helping people make a connection to get into drug treatment, as an example. And slowly but surely, people realize that the evidence around syringe services programs is so strong, and all kinds of fears have not been proven out by evidence, that they have become at least far more accepted now with federal funding. And I think on this issue too, as difficult as it can be, a public health approach says, we want to prevent it. Let's figure out what the problem is, what we know about it. Let's think of strategies, and then we need to assess whether they work or not. And if they work, the proof is that you have fewer children suffering. So with my last comments here, I want to make some thoughts about, from my understanding, what I've learned from Elizabeth, from this experience that I had in Prince George's County, about what might be part of public health strategies to prevent childhood sexual abuse. And I would ask that you consider some that relate specifically to childhood sexual abuse and others that are more general approaches to protecting families. Something that public health appreciates is that when you're looking for solutions, they don't always have to be so narrowly targeted. They can be more general solutions that actually have an impact on the thing you're trying to prevent. So the specific things for childhood sexual abuse are the kinds of ideas that we explored with the help of the Moore Center in Prince George's County, but applied more broadly than just one school system. For example, the Bloomberg American Health Initiative is pleased to support Professor Letourneau's work with major child-serving organizations, including YMCA, the Boys and Girls Clubs, and Big Brother, Big Sister, to strengthen their approaches to prevention. I understand what she is doing now are really updating the best recommendations for organizations on all the kinds of systems they need to have in place, fixing this mindset that it's about educating children about strangers, completely different, helping adults realize their responsibility. And we intend, as those new standards become available, to make them more broadly available through some of the resources we have so that any organization that's serving children can adopt them for prevention. Now let me talk a little bit more about more general approaches. I think that more general approaches start with the fundamental insight that we expect families to protect children. In a sense, by supporting families and supporting parents and strengthening families, I think that it's likely that we can prevent some significant fraction of abuse. For example, when a parent is a victim of intimate partner violence herself and has no route for escape, she may not be able to protect her children from abuse by others. And so really making sure that we're thinking about, first of all, preventing intimate partner violence, but helping people in that setting, assuring that there are adequate resources, I think is probably also childhood sexual abuse prevention. Here's another example. When low-income parents are forced by economic circumstances to leave children in childcare settings that make them nervous because they can't afford quality childcare, the risk of childhood sexual abuse may increase. In those cases, it's not the case that parents are not thinking about protecting their children. They may not have the ability to put them in safe environments given the economic circumstances that they're in. And I think the broader agenda connecting some very important social needs to the issue of childhood sexual abuse may be productive. And here's another example, a little more specific, but when parents are told they can't come into an exam for their elite athlete child because it's up to the doctor, why wouldn't you have a parent in the room like that, just like for any other medical exam that they would be having? Something is wrong there. So I think that parents are very important for protecting children, and we need to think about different ways to support the family so that they can do that function. I appreciate those are just some thoughts that I have there to share, and I know that there are many different challenges, and you guys really are the experts in the work that you do. So I think my main point in just sharing those thoughts is that I see from a public health perspective, thinking not just about very specific solutions, but also more general solutions that can address more common underlying problems. So I also appreciate the interdisciplinary and international collaboration reflected here today. The threat of childhood sexual abuse certainly knows no geographic boundaries. I'm curious how many people here are not from Baltimore? Wow, that's a huge number. And how many people here are not from Maryland? And how many people here are not from the United States? Oh, wow, we got more than one. So thank you all for coming. I hope that this is an opportunity for a tremendous amount of knowledge sharing and strategic thinking that helps all the work that you're doing. The connections you make here today should allow for more progress than everyone going at it alone. I'd like to conclude with an observation. I think people think about childhood sexual abuse primarily or exclusively as a matter for criminal justice, in part because they want to feel like they're strong on the topic, that any other discussion is weak. But when we think about things from a public health perspective, a nation that is punishing perpetrators but has thousands of victims is not tougher than a nation that invests in prevention and has far fewer victims, even as it punishes the perpetrators that are still there. In fact, a nation that is not doing prevention and as a result has more victims, in my opinion, is a much weaker nation. And I think there's every reason to feel like the work you're doing today is about the strength of the response, the quality of the response, and in the end, the value of the response for children. So thank you very, very much for having me, and I really wish you the most productive day today.